Everybody, so today we have a new topic to read. It's called hyperventilation syndrome. Hyperventilation syndrome. Now, what exactly is hyperventilation syndrome? The point is, you always come across terms like hypoventilation syndrome, which could hint you into believing something like OSA, obstructive sleep apnea. But here we're talking about hyperventilation syndrome. So the idea behind hyperventilation syndrome is that it is one type of disorder which has to be differentiated from panic disorder, because panic disorder is also a condition where you seem to hyperventilate. So hyperventilation syndrome means a syndrome where you hyperventilate. Is there any abnormality? No, you have no other abnormality. Your the patient says, I am, I can't feel enough air. Like, the patient probably says, exquisitely says, I can't get enough air. I can't get enough air. So that's the whole idea. The patient says, I can't get enough air, but when you do all the investigations are normal. Her pulse oximetry is normal, her ABG is normal, her blood pressures are normal, her temperatures are normal, respiratory rates are normal, everything is normal. But still the patient says, I cannot get enough air. So this is something which can also be seen in patients with panic disorder because they are panicky. But how do you differentiate panic disorder from hyperventilation? Is that in panic disorder, you also have other characteristics of panic disorder, which could be impending doom. It can be palpitations, chest pain, nausea, sweating. So at least 4 out of the 13 symptoms that you read about in panic disorder should be present for it to be a diagnosis of panic disorder or panic attack. On the other hand, if you do not have at least four classical symptoms for panic attacks, it is hyperventilation syndrome. So what the understanding here is that hyperventilation syndrome is a diagnosis of exclusion. So you exclude everything, and if you don't reach a diagnosis, you call it hyperventilation syndrome. And the manifestations will typically develop when you have you could either have the respiratory rate going up, or you can have the depth of inspiration going up. So the patient might take a very deep breath and then sigh, or the patient can can be tachypneic. Will be breathing at a very, very faster breathing rates. Now, because the patient is hyper breathing, overventilating, patient will have alkalosis, respiratory alkalosis, and respiratory alkalosis is going to trigger hypocarbia. And as you have hypocarbia, or maybe you can just think of respiratory alkalosis. Respiratory alkalosis, or alkalosis in your body, is associated with decrease in calcium. It pushes calcium inside. So you have hypocalcemia, and the symptoms of hypocalcemia like tetany can occur. Neurological symptoms including paresthesias will happen. The patient might have headaches. There might be lightheadedness and carpopedal spasm and the neurological symptoms in hyperventilation syndrome are as a result of cerebral vasoconstriction. The idea is you have flushed out the carbon dioxide from your body. Carbon dioxide is a cerebral vasodilator. There's less CO2, meaning there will be cerebral vasoconstriction, and all the stigmata of neurological symptoms that you come across will be seen. How do you treat hyperventilation syndrome? So the most important treatment is reassuring the patient that everything is fine with her. So you educate the patient and reassure her, and then you educate her on performing something called abdominal breathing. So you ask the patient to breathe abdominally. It's basically you have to ask the patient to restrain her chest while breathing, and it takes some practice, but most of the episodes usually resolve after the patient starts abdominal breathing. If at all this is refractory, you can try a low-dose benzodiazepine. So low-dose benzodiazepine can be tried in the patient. Low-dose short-acting benzodiazepine like lorazepam, which will be the second line treatment for hyperventilation syndrome. If everything fails at the last, you could also have told the patient to breathe in. This is an off-label sort of a treatment. It's not recommended, but you can tell the patient to breathe into a paper bag, because that's going to help the patient rebreathe CO2, thereby raising the CO2 levels and kind of treating the disorder. So let me repeat it again for you. We discussed about hyperventilation syndrome. It is a syndrome where the patient is feeling short of breath. The patient feels he cannot he's having shortness of breath, but all the findings are normal. There's nothing abnormal on the investigations. You have to differentiate it from panic attack, but in panic attack the patient will not come to you with most only shortness of breath. The patient will also have other symptoms of panic attack like impending doom or palpitations and chest pain. Then the next thing is the patient here will be having respiratory alkalosis as a result of hyperventilating. She's ventilating more than needed, and that's going to cause hypocalcemia. It's a trigger for hypocalcemia that can lead to carbopetal spasms. Decreased CO2, decreased PaCO2 can cause cerebral vasodilation, vasoconstriction. I'm so sorry, and that can lead to the neurological stigmata of paresthesias, headache, lightheadedness of the patient. How do you treat it? The treatment is basically also you can either have the hyperventilation can be either because like through increased respiratory rate, so the respiratory rate could be increased, or the depth of breathing could be increased, where the respiratory rate will be near normal. How do you treat the patient? First, you reassure the patient that everything is okay with her. Then you educate her to do abdominal breathing. And if this fails, you can give a low dose of benzodiazepine like lorazepam, which is short acting, and that's the official treatment. But off label, you can also ask the patient to breathe in a bag, into a paper bag that might actually just tilt her PCO2 levels a little up. And that concludes this discussion on hyperventilation syndrome.